Thank you all for coming. I'm going to give you a quick summary today of the results of the Manganese program that the initiative began in the fall of 2013. All the public water suppliers in the state were required to do a baseline sample for manganese in 2014. We had more than 4,000 samples collected by 1,400 public water suppliers. Often the public water suppliers had multiple entrance points into their distribution system, so they had to take multiple samples. Consecutive systems and vending units weren't required to sample. The reason for that is the focus of this initiative was to look at manganese entering the distribution system. We know that consecutive systems can have problems with deposition of manganese in their distribution systems that require frequent flushing. But the focus, again, was the manganese entering. So what do we find? The good news is that the majority of public water suppliers had manganese levels below not only the health advisory level, but also below the secondary maximum contaminant level. This graph is the results with the 4,000 samples, and about 3,000 of them were below the secondary maximum contaminant level. There were several hundred that were over the 0.3 health advisory level. That includes confirmatory samples. There were 122 public water suppliers with a confirmed result over the 0.3 milligrams per liter. This is 7% of the public water suppliers in the state. There were more non-community systems than community systems over the health advisory level. This slide shows the manganese levels broken down by region of the state. We did find manganese in all parts of the state, from Sheffield in the west to Truro on Cape Cod. The largest number of public water suppliers with elevated manganese were in the central and southeastern parts of the state. We can't definitively conclude that the most manganese is found in the central and southeast parts of the state, because remember, these are finished water sampling results. So if a public water supplier had treatment that was effective in removing manganese, it wouldn't have shown up in these results. On a side note, I wanted to mention that even though manganese is found in both surface and groundwater, our 122 systems that were over the health advisory were all groundwater systems. So of the 122 systems that were over the health advisory level, some were because they didn't flush the sampling line, or they had turned on an emergency source just to sample. There were some that were able to lower the manganese level immediately by shutting off a well, or changing their blending ratio, or just optimizing the treatment. So if a public water supplier was able to immediately lower their manganese level, they weren't required to issue a public notice. So we had 47 public water suppliers who issued a public notice in 2014, and that includes 13 who had put the health advisory language in their consumer confidence report. There were 38 transient non-community systems that were over the health advisory level of 0.3, but not over the acute level of 1.0. They weren't required to issue a public notice. A decision was made because the individuals weren't getting all of their drinking water from that source, that was a safe level. This is an example of a public notice that was issued for a community water system. The NTNC one is similar to the community one. It's just that you don't mail it to the customers, you post it by your water taps. It's a complicated message to convey, because we don't want to scare people that there's something wrong with their water, because manganese is a nutrient that we all need in our diets. The emphasis of the public notice was on infants and children under the age of 1, and we put a baby bottle up in the corner of the public notice. If a non-transient non-community or a community public water supplier was over 0.3, then they were required to do a long-term corrective action plan. And our MassDEP regional offices, as well as Mass Rural Water Association, is helping the public water suppliers come up with these plans. They have 180 days to submit the plan. And I know public consumers often don't want to pay for even maintaining their water system, never mind installing treatment. But issuing a public notice, especially when it concerns health of children, really gets their attention. And we had one community water system that at town meeting year after year voted down installing treatment, and last year they finally voted to install treatment. There were a couple of special cases I wanted to mention. One is there were 7 schools in the state that had manganese levels over the health advisory. They didn't have infants, just school-age children, but the schools were very proactive in addressing the issue. Some of them sent voluntary letters home to the parents, and they aggressively are pursuing treatment or other sources. So going forward, we have about 200 or 300 public water suppliers in the state doing quarterly sampling for 2015. The reason for this is there's seasonal variation in manganese, and we want to make sure that they don't go over the health advisory during the year. These 200 to 300 systems are the ones where the manganese level was between the secondary level and the health advisory level. At the end of a year, we'll reevaluate the 4 quarters of sampling to put them on a different frequency of sampling. One question we get is, why is Massachusetts doing this? This is not a federal standard. There are other states doing this. There are, in fact, 9 states that have established a health-based maximum level for manganese in their drinking water. A number of states also have either guidance developed or educational materials. And I wanted to compare that last slide to this slide. The 9 states that are regulating manganese are also the ones that have the highest level of manganese in their drinking water. This is a USGS map of manganese levels in drinking water. And the red and the yellow are where the highest concentrations are in the groundwater in the United States. The EPA just came out with their contaminant candidate list, and they put 100 chemicals on this list, and they do this every 5 years. Then they spend the next 5 years studying the list of contaminants and determining whether any warrant the establishment of a maximum contaminant level. So manganese is on the list, and so they'll be studying it for the next 5 years. So if EPA decides to do a maximum contaminant level for manganese, it wouldn't be soon, if at all, but they're looking at it. So we don't want to scare people that there's something wrong with their water, but we do want to make sure that children are protected. I wanted to show you one more slide about the health effects of manganese in drinking water. This study is relevant because the manganese levels are the levels we're talking about today. This study is actually from Bangladesh, and it was looking at children drinking water from different wells in different villages. And you can see there's a definite IQ drop with the increasing manganese levels. So I just wanted to drive home how important this initiative is for all of us who are public water supply professionals. So that was it. Any questions? Great. Thank you.